very little water, and as you said, clean water at that. Okay, what about fumigation? Because people, okay, that's the first thing that it's a knee-jerk reaction. When there are mosquitoes and there's a dengue scare, uy, mag-spray kayo sa bahay, ganyan. Oh, labas nyo na yung mga raid nyo, yung bygone. What do you ladies have to say about fumigation? Doctora?
As far as the Department of Health is concerned, they want to stay away from fogging, from fumigation, because actually they will just they don't really have a long-term effect, no, as far as the mosquitoes are concerned.
Pero hindi ba pinapatay ng fogging or fumigation yung mga mosquitoes?
Pero pansamantala lang kasi yun eh.
Pero patay na.
Maaalis lang nila pero they will still be there. No, kaya ang gusto natin is really to have some more on prevention and like the use of insect repellents rather than this fumigation.
You're talking about mosquito repellent that you put in your body?
Yes. Also on the nets, the mosquito nets. No? So you can spray insect repellents on them.
Okay. Now, let's talk about, when we talk about prevention, this mosquito, people here, I mean, like lay people like me, we read about it and we hear about it, and there are those who say that this mosquito only bites, let's say, during certain times of the day. Is that true?
I don't actually
believe.
They say
nighttime
it's a day-biting mosquito.
Day-biting lang pala
as
to,
long as
hindi
there's light.
Okay.
As long as there's light. So even during the afternoon, as long as you're inside with lights, they won't mind. They'll bite you. So
even at night, as long as you're saying as long as there's
as long as there's light.
There's light. Then, if you're in a dengue area, you are at risk of contracting this disease. Where are the hot spots, doctoras, in the Philippines for dengue? I mean, obviously the urban centers.
NCR.
But here, would you have any information, say, about Metro Manila? Where are the hot spots currently?
We have a lot in Metro Manila, particularly in Quezon City. But in other regions of the country, as you know, the Ilocos region, no? So there's a lot of dengue cases now. That's why it has been declared in a state of calamity.
Wow. Okay. Prevention. Dr. Kathy, you said that emptying water containers and then kailangan pang i-brush yun. What else can people do?
Kasi they like breathing on the walls of the container, not just the water. So on top of the water and around or the walls of the container.
When we're talking about containers, usually, which household containers are we talking about? Mga tabo?
Tabo, vases, or vase if you want.
Okay.
Used tires, yung mga gallons of water.
Empty water bottles, empty mineral water bottles.
Furnitures or utensils that can accumulate water or rainwater.
But see, if so little water is needed for this species to propagate and to survive, okay, let's say you have a garden. I mean, there's a million places where a million potential breeding grounds for dengue.
They can live in a cup leaf.
Yeah. So what can people do, really? Just do the best they can and clean their surroundings. What else? Let's say personal habits. What can people do to avoid getting dengue?
Maybe wear like long sleeves and pants. Less exposed skin's better. The DEET containing insect repellents. I think that's the most common and most studied na repellent.
Okay.
Doctor, do you have anything to add?
I guess
maybe you want to ask citronella, but
yes. Okay. What about citronella? This so-called herbal anti-mosquito.
We don't have yet studies, although earlier Kathy is saying that she was able to read a meta-analysis, but in the clinical practice guidelines of the World Health Organization, it's not yet part of the guidelines. Maybe in the future, once there are really several studies on that.
Yes, because DEET also has some issues. Prolonged use of these mosquito repellents, chemical-based. There have been studies that come out that they can actually be harmful to the health, and so a lot of people are avoiding using this, ergo turning to so-called herbal.
Yeah, they mentioned that the most common adverse effect would be brain damage, right? Like seizures, especially in kids. But I think they're using the high-dose DEET Because usually you have 10%, 20, 30%, 50% DEET in different insect repellents. And I think the CDC and the American Academy of Pediatrics is only recommending 30% or less DEET.
Yes, yes.
And ideally, when you apply DEET, you have to apply it several times a day because it doesn't cover you or protect you for 12 or 24 hours. And before reapplying, you have to wash off.
Wow.
Before you reapply DEET.
Why is that?
Because of that. Because of the
the possible harmful effects of DEET. Now,
and it can cause dermatitis or skin irritation.
Now, for parents who have kids, preteens, and usually children go to school, what is the uniform? Short pants. And they're usually out a lot, and the classrooms may not be screened. So what can parents do to avoid, to prevent their kids from getting sick?
Okay. I can't speak for all schools, right? But I have a daughter.
Okay.
And she studies in Poveda. And Poveda has a good anti-dengue campaign. So they allow kids to go to school wearing jeans, long sleeves, or jacket.
Yun yung anti-dengue campaign ng Poveda,
aside from
Institusyon Teresiana.
Aside from we have bloodletting, but at least
it's a practical solution, sure.
Yeah.
I know.
Yeah.
We have a lot of like mga pamphlets.
It's the same thing with my daughter in Saint Scholastica.
Yeah, but still,
they have to
I'm not
wear
making
that.
light of it. I'm saying it's a no-brainer. I mean, yeah, cover yourself up. That really is the you know, I also do a lot of traveling in Africa, and in Africa naman yung malaria naman yung sakit doon, di ba? Especially East Africa. And yun yung ginagawa ko. I never wear shorts. It's always long pants, trousers, and long sleeves. Kasi at least yung lalagyan ko ng DEET, konti na lang, di ba? Hindi na kailangan buong katawan talaga. Okay.
Yeah, and that's one advice. You can't apply DEET under unexposed skin. So only the exposed skin.
Dr. Kathy, what is your experience working as a pediatrician, working with children with dengue? I mean, how is it with kids?
Can you just say, because kids don't read medical books. So they
I don't read medical books.
They don't read medical books. So when they present, they have different, how do you call that, manifestations.
Yeah.
So it's a guessing game. No, not actually. So you have to be, how do you call that, more cautious. And ang most important would be to give the parents anticipatory guidance. So
define that, please. What is anticipatory guidance?
Explain what's dengue.
Okay.
What are the common causes of dengue? What are the common manifestations of dengue? And what are the warning signs para they'll say, I really need to bring my baby or my kid to my doctor or to the emergency department.
As Dr. Irene was saying, diba, 3 days and your fever hasn't gone down, plus perhaps other manifestations, other symptoms, it's time to see your doctor. Seek professional medical advice and treatment. What about like other groups? Let's say mothers, pregnant women. How does this affect them? Have you any experience with that?
I don't have any experience. More reading case reports from Thailand, Bangladesh, because dengue is also endemic in those countries.
Yes, yeah.
So pregnant women can get dengue. They usually present from case reports. They usually present like any other patients with dengue. But the important thing to know is they can also infect their babies, even though the babies are inside their tummy.
Wow. How does it affect the unborn infant?
So through blood, kasi diba, baby stays inside,
yes.
and then you have the umbilical cord. So it's vertical transmission. That's what we call it. It's like the same. It's like any other congenital viruses, that rubella or those HIV. You transmit it to babies through vertical transmission.
But how is that? The baby, there are cases where the baby is born with dengue, infected
usually
with dengue.
they don't present initially with those rashes and everything. After a couple of days, usually 3, 4, 5 days, some of them would present with petechiae or those pinpoint rashes. Some would have fever. And because if you're in an endemic area,